Hi, Sally Walker here, your hormone and slow age expert. So what are the signs and symptoms of benign prostate hyperplasia? So the symptoms of enlarged prostate. What are the symptoms here? Because they're very, very typical. And just to give you a heads up, prostate cancer initially doesn't give you any symptoms. So because you're having some of these symptoms of enlarged prostate does not mean to say that you have prostate cancer. So let's have a look at some of the symptoms. So a weak or slow urinary stream. Okay, so this means that your pee doesn't come out as fast as it used to. Very slow, very weak. You know, you seem to be standing there for a long time trying to pee, which normally would have just taken a minute or so. So that could be one. So this feeling of an incomplete bladder emptying. So you have a pee, but you really still feel that you want to pee some more and you can't. So you might also have difficulty starting the urination. So you're desperate to have a pee and you just can't start it. You see, this is because that the prostate gland is encroaching, is growing around the urethra and it's pressing on it, so it's actually closing it. So your urine doesn't come out, or it comes out in a very thin, very slow stream. So you might feel you want to go to have a pee all the time, basically because you never get to empty your bladder. So 5-10 minutes later, you feel you want to have a pee again. You might suddenly have the urgency to urinate, so you'll rush off to the toilet, but you might, again, still not be able to start the flow. You might be getting up in the middle of the night to urinate. This is sort of the very typical sign that something is happening, where you have to get up several times in the night, okay? The urinary stream, you know, it might be slow, it might be weak, and it might stop and start all the time because, again, that pressure on the urethra from the prostate is so tough, it's so firm that the urine just simply can't pass through. You might find that you're straining to urinate, and you might find that you have a continual sort of dribbling of the urine because it doesn't completely stop. You don't empty this bladder, so there's maybe little bits coming through all the time. And you find that you're returning to urinate every few minutes kind of thing and never really seem to be finishing. So these are the very classic symptoms. And as I said, they don't really relate to prostate cancer. Only as the cancer growth grows, will you begin to get some of these symptoms. But the cancer can be going for years and years, basically, before there are any sort of real symptoms. So the PSA, we'll talk about that in another video, is a way of diagnosing. I'm not going to say it is the complete answer, but it is part of the answer for diagnosing your prostate problems. Anyway, that was the symptoms of benign prostate hyperplasia. Have a little look at the articles, have a little look at the other videos for some more information about prostate health. Happy hormones, happy life.